This is the DocNation podcast. We are a movement founded by doctors, for doctors, dedicated to empowering medical professionals to reclaim control over healthcare decisions and advocating for their fair share of the industry's resources. Please note, the views expressed are those of DocNation and not necessarily those of our guests or referenced health centers.
Well, first of all, Evan, thanks for being here. We appreciate you carving out some time in your day to join us.
No, my pleasure.
Yeah, we might as well just start now. Can we just start now?
Yeah.
Just a very, very casual conversation, a real conversation. As you see in politics, just real, straightforward conversations are very, very effective on both sides. That this is a nonpartisan comment, but
yeah,
that's the aim and that's the goal for this podcast. So thank you so much, Evan, for your time. DocNation exists to do two things. Number one is we help doctors on an individual level, and that level is just like a professional athlete has an agent. We are an agency for doctors. So we invite people to give us a call, send us an email if you have questions about what those services look like, but it is the full gamut. And the full gamut's like, okay, but I'm thinking professionally, but it's everything. We'll help you buy a new car. We'll help you sell a home. We'll negotiate your contract. We'll review your contract. We'll help you find a new job. Matter of fact, we were speaking with someone late last night till almost 7 o'clock. And she's looking this individual is looking to move back to a different country because she's not getting, she's not being respected at all. And she comes to the meeting and she's like, it's just the nicest human in the world. I mean, I was fired up last night. It was difficult for me to go jump back in with my family, but I will say she's been working there for 8 years, and they're making it very difficult for her to travel abroad to see her family. And Jess and I start licking our chops, and we said, this is exactly why you have us. We're going to get you what you want, whether it's finding a new job for you. She didn't even consider that for some reason, but she was ready to put her 2 weeks in. She was asking us, what's the best way to put your 2 weeks in? And I'm just proud that we're able to do so much more than help people put their 2 weeks in. So that was a fulfilling conversation last night. And then the other aspect of DocNation is we exist to create a union. Healthcare is in shambles right now. And I'll just, in my opinion, I'll say why I think it's in shambles, and we can get into that a little more later. But in my opinion, the star players have been relegated to the bench, and the people who need the star players, the fans who pay to watch the World Series, have lost all respect in the position because of the multiple middlemen like the insurance companies. So that was a little bit of a preamble. Without further ado, Evan, would you please tell us who you are and what brings you here today?
Well, I appreciate your baseball analogy, first off.
It just helps people understand it a little bit better.
It's all right. I understand it just fine. So I've done a variety of things in healthcare. I practiced internal medicine for 20 years. I represented hospitals on their Medicare appeals as well as their commercial denials. I actually contracted for a period of time with the Department of Justice doing fraud, waste, and abuse. I actually led a fraud, waste, and abuse team for a period of time.
Wow.
Very active with the American College of Physicians. I sit on actually their subcommittee for coding and policy, and I'm on the editorial board for ICD-10. So I've done a lot of stuff in
sure have. Wow.
What triggered you to go from being in practice to then these other initiatives, these other aspects? What led to that?
That's a great question. And I really got to the point where I wasn't enjoying being in practice anymore. And, you practice because you love taking care of patients, and I wasn't enjoying it. And I decided to transition out.
Was that like midway, or was it toward the tail end of like 20
I
years?
practiced for 20 years.
Okay.
And, personally, because I've worked with a lot of physicians that transferred out. I led a lot of physician teams. About 15, 20 years, I'm seeing that physicians are getting tired of it, just for the the reasons which you previously stated, and are looking for something else to do.
Mhm.
What would you say is the biggest difference from when you started practicing 20 years ago to when you stopped practicing, in regards to patient care and how your interaction with the patients are?
So, I actually started practicing when things were changing quite a. They hadn't changed all the way, but certainly what you're seeing now is more physicians being employed. They're having their schedules actually made for them. So you come in, you're expected to do so much. You expect to see X amount of patients, allot this amount of time per patient.
Yep.
As the technology in healthcare has basically increased now you got your prior authorizations, you got more expensive testing that you would like to be able to use, but you're limited to use. You're definitely spending more time fighting payers to get things done. And as you said, patients, their only interaction is with the physician, and they tend to take it out on the physician because that's the only person that they see.
Yep.
Because they're in the process, they're going through the process. It's a miserable process for them, but they don't understand that their physician who they're talking to is being handcuffed in so many different ways.
I think also I've realized the physician doesn't really have all those answers either. I mean, the goalpost shifts so much. I can't keep up with what codes to use and what insurances cover what. We didn't learn that in med school. We learned how to take care of patients and how to treat diseases. And unfortunately, I feel like we're getting pulled in 18 different directions. And I think that's leading to that burnout you're talking about.
Yeah, absolutely. A lot of physicians are leaving practice either to do administrative type work or just get out of healthcare altogether.
One of the best lines one of my partners said is, "Medicine's the hardest thing I ever worked at to get into, and now it's the hardest thing I'm working at to get out of."
Wow.
Yeah, yeah.
Which is sad to see because we want our best and brightest in medicine and stay there.
And that's an excellent point that you raised, because it was in the past that the best and the brightest did go into healthcare, and I'm not sure that that's the case anymore.
Well, the
Yeah.
best and brightest see the writing on the wall, and they are smart, and they're looking at things, and they're making a judgment call on how to set themselves up. They're not ignorant to the situation and what's happening. You had quoted in a previous article about how 77% of physicians have gone from being in an environment that was autonomous to now being told what to do, told what to think. And really, we're in the situation where they want doctors to function like factory workers instead of thinkers. What do you think has led to, if you had to summarize, like pinpoint what the cause of that switch of 77% leaving being in charge of their own life and charge of how they see patients, what's led to that?
So, that's an excellent point, and it's a complex issue. I don't think that physicians necessarily want to sell their practice and become employed. Although, really, if you look at physicians coming out of training right now, most of them prefer to be employed, but to run a practice is incredibly expensive, particularly a primary care practice where you're basically office based. The overhead is tremendous. You got computer systems, electronic records, and a lot of what I see is a lot of the practices that are being sold to, whether or not it be a insurance company or a hospital or the private equity, it's not necessarily because that's what they want to do. It's because that's what they have to do, or they're going to have to close their doors. And I think the big issue is whatever entity buys a practice, is their major goal to keep the practice going and provide good health care, or make a profit? And if it's to make a profit, then that's where the physicians really suffer, because they move in, they get rid of personnel, they try to cut costs as much as they possibly can because they want to turn it over and sell it. Whereas, I think there are instances where physicians are employed that, everyone's got their preference, but, things like Kaiser, Mayo, Cleveland Clinic, these are employed physicians, but those entities want to provide good health care. Their goal is to provide good health care. And there are some physicians that are pretty happy in that situation.
Yeah, their marketing, their marketing is good healthcare. So that's what matters for those companies. But I agree, it's hard to see, people have to stay on for 5 years and you lose half your staff. And the reason for that is there's no extra money coming in from CMS. The cuts come every year. So
Right?
if you can't put money on the top end, you have to get rid of money on the bottom end to make a bigger profit. And the only way to do that is to reduce overhead, which makes the doctor's life harder.
Yeah,
Right.
no,
And it's
that's exactly
unfortunate to
right. I
see.
mean, Medicare just proposed another,
Just got approved. Just got
yeah,
approved.
yeah, another cut to physician salary. Not only is it being cut, but it's not been increased commensurate with the cost of living. So
Yep.
even though it only looks like a 2.5% cut, it's something like 20% when you factor in the cost of living.
Yeah, it's hard to see. It really is hard to see.
Earlier this year, there was a letter issued. I think it was like 200 plus members of Congress that were talking about supporting no more cuts. It was bipartisan. And to read what you mentioned earlier about us existing for a union, us existing for advocacy, people get afraid of the word union, or they get afraid of striking, or they get afraid of these different terms. They feel like most doctors aren't aggressive by nature. They're very much patient first and wanting to connect with people and help them, very servant minded. And we're in a situation where we can no longer have things go as they are. And there is support. There's lots of support on Capitol Hill, in DC, to do this. What would you say, Dr. Pollack, would be some things that doctors can do to be proactive to gain their voice back? You've done some things where you've given yourself even more freedom as you transition. But for those that are in practice today, what would you say? What would you encourage them to do to have their voice be heard in their workplaces, within their associations, to bring people together so that way it's not like everyone is just going in their own direction, competing voices? We got to get on the same playbook and call some of the same plays to move forward, to be large enough to push back on these cuts.
Yeah, no, that's a good point. I mean, physicians, I think in general don't want to get involved in big organizations and don't want to involve themselves in that type of advocacy. But my recommendation, and personally what I did, is I did get involved. I got very involved with the AMA. And you could say what you want about the AMA, but they're the largest lobbying group for physicians in the entire country. And, I always tell people, you don't like what the AMA does, join them and change it, because that's your voice. You can't sit on the sideline and say, well, I don't like what they do. It's like, our election, you don't like who's in office, you have to vote. And so you have to get in there. Then there's specialty societies. I've always been a big fan and gotten very involved with the American College of Physicians and their advocacy. I've gone to their leadership day a number of times. But you need to get out there and get involved. The AMAs, I mean, what they'll tell you is, you don't even have to show up for me and give us your money and let us advocate for you. And they do a lot of advocating.
Yeah, and I think, the younger group of physicians coming out is really soured by the AMA. That's the word in the street. It's gonna be it's a problem, because either we need the AMA to, because all they're seeing is, hey, the last 10 years have not gone well for physicians, and the AMA has been in charge of the advocacy. I'm hearing no one joining. I'm a part of the AMA. No one is joining the AMA coming out of residency and med school, which is a problem. And the twofold solution is either the AMA has to recognize that and has to, change. I think that you don't just say, hey, we're going to do the same thing and ask for more membership. I don't think that'll work. I think they have to come out and say, hey, we understand this has not gone well in that last 10 years and we're going to change. or someone else has to step up and come in and say, hey, we're going to advocate more. Because I agree, there's not just a sit in the sidelines. We can't just keep doing the same thing. We
No.
can't, and I think a lot of physicians kind of just are used to it now.
The truth is that's why DocNation exists.
Yeah.
To help support the AMA in any fashion, or to become a similar governing body just like them. We want to support, we want to help. So maybe this is the bridge, Evan, for maybe a meeting at some point with whoever we need to meet with at the AMA.
With the AMA, you know, to say like, hey, you know, we're physicians that want to get things done. You know, I'm just going to throw this out, but the membership of the AMA is pretty expensive for a physician. The AMA does not make its money off its membership fees. It makes it off the CPT, where it makes millions and millions of dollars. Make the membership free.
Yeah.
How much is the membership?
Especially the young guys with $300,000 in loans.
Right.
They don't have, I mean, it's sad to say, but physicians these days don't have that money to throw around.
No, I think it's like about $800 or something like that. Make it for free. The AMA does not need physicians' dues in order to run, because they charge a fortune for CPT, and they own CPT.
They need the numbers. I agree with that. That's a great idea. At least for maybe your first 10 years of practice, it's free.
Yeah.
And then, I agree with that. That would be a great idea.
Justin, this segment was started by your question about what would you do, Evan? I'd like to just share a story from less than 12 hours ago, the same meeting we had last night. And this physician said, first of all, she's the least combative human I've ever met in my life. The nicest human.
It's most physicians. We're not.
Seriously,
she wouldn't hurt a fly.
The nicest, sweetest, most hardworking. What she had to do just to get to the States to become she's just one of the most amazing people I've ever met. And she said, I don't want it to sound like I'm pointing fingers or anything, but really what's difficult right now is our nurses are underperforming, and they know they can underperform, and they're not showing up as much as they should. And administration won't discipline them, let alone fire them, because they have a union, because they're strength in numbers. And she said, she ended it with, it's easier to fire one of us, one of the physicians, and just replace us. And that broke my heart last night. It was like,
how's that even possible? How did it get to the point where it's that bad?
This is, and I'm not disrespecting nurses, but just level wise, it's like saying, okay, Shohei Ohtani, the best player in Major League Baseball. Okay, yeah, we're going to fire you instead of the third string guy. And
instead of that boy.
Why?
Yeah.
What that shouldn't even register. That shouldn't even make sense. But why? Because administration speaks the same language that now the nurses do. Power. Okay, where there's going to be a legal issue. There's going to be a big fight. We don't want to fight that. What's the group that physicians.
I'll tell you a quick story about my experience in the AMA. I served as a delegate to the AMA for 8 years. And one of the meetings was interrupted by a group of medical students who actually forged the ID and barged into the delegate hall. And what they were doing was they wanted a public healthcare policy, right?
Yeah.
And the perception was that the AMA is against this. However, that actually came up for a vote with the AMA, and it was so close, whether or not to support it or not. It was so close that they had to do a ballot in order to do it. It was just a few votes. And I couldn't help but thinking that instead of barging in and banging on a bunch of pots and pans, he had joined the AMA and gone in there and voted.
They would have switched the vote.
It would have passed.
When was this?
Here's a question.
That was a few years ago.
I have a question that I think a lot of people want to know, and I don't know if you have the answer, is do you think the AMA does enough, or can they even do enough to fight the CMS cuts? I think that's what people
fighting
want.
it. They are presently fighting
it. Why does it
it.
keep happening? What are we doing that the cuts are almost a yearly thing. I mean, it's almost
Yeah.
like here's your Christmas present, here's your 2.5% cut.
So
Where,
one
where
of
are
the
we
things,
missing? Yeah.
yeah, one of the things I think people don't really realize with healthcare is that healthcare is a pie, right? And if one entity grabs a bigger piece of pie, someone has to get less.
Mm-hmm.
So that same money's being divided in for physicians, for hospitals, for
That's it.
pharmacy,
Yep.
for payers with the Medicare Advantage. It all has to be split. And if you pay somebody more, somebody gets less. And clearly, more money needs to be put into healthcare. And I think that's the make it a bigger pie. That's the only way you're going to get a bigger piece. But the end of
Who's
the day,
getting the added percentages when physicians are getting the cut?
well, there were so there were some areas that got like I think the rehab facilities got an increase, and there were some increases in coding that if you put that you're doing a more complex patient that you can add on to your fee a little bit. Didn't help all physicians, but it might help some.
Mhm.
But certainly it wasn't a whole lot. But this is a huge issue with the AMA. I get their newsletter on a regular basis. They are fighting it. I don't think most people know it, and it's not like I'm a big AMA fan, and I appreciate other doctor organizations as well, which go out there and fight. And what I would like to see is I would like to see these groups in the AMA delegation meetings with a voice there, because all doctors should fight together as one voice. The AMA, if I was going to give other than their dues, one of my criticism is that they keep people out of their meeting, and they should not be doing that.
Maybe that's something we can help out with. Maybe we help them get more outreach, more participation among the
Yeah.
members. We rally the medical students as the next generation to get more plugged in. I love the visual, what you're talking about with the pie. If the pie's like this and we need it to turn into this, well, people are going to complain, well, there's so much money spent on healthcare. We spend double, triple, or whatever other countries spend on healthcare, blah, blah, blah. Well, maybe there's money being wasted in other ways in our government that we do a little bit better job of managing the money there to then put some more money into the pie that should be for healthcare that affects everyone. I
But
think about this all the time. What am I getting for the tens of thousands of dollars that I spend on taxes every year? What do I get? Do I get really anything? It's the connection between value and so healthcare affects everybody. It's so critical that we receive quality, and we have more money spent on healthcare. We have access to more information. We have more research. We have more technology. We have we have the most of everything we've ever had ever in society. And yet the quality of our healthcare, you look at the average person, we're in the worst shape ever as a society. And
That's exactly right.
maybe that's because the pie that you said is not big enough, and the
I think,
slicing of the pie isn't to the right people.
Right.
and Dr. Pollack, I'd love to hear what you think about this. To me, the pie is an interesting take because the pie that we're talking about is the money from the government.
Right.
I think a lot of money gets lost in healthcare to private insurance. The profit that is made and the overhead that is there in private insurance is enough to fund.
So
health.
here's the thing about the private insurance, and I'm reluctant to ever adopt a stance where one entity is a bad guy, and
I'm not saying they're bad. I just think there's
yeah.
yeah.
So here's the thing: let's take like United Healthcare, right, which is the largest, and they're attempting to monopolize healthcare in a way, but
Yes.
they do not make the majority of their profit off of their health insurance plan. profit margin, last I heard, was something about like 5%, which if you compare it to like a tech company, which is 20%, they're not making a huge amount. They make a lot of their money off of the Optum RX.
Hold on. The tech company has a product. What
Right.
product does United Healthcare have other than sick people?
Well, right, but well, my only point is that the majority of their profit comes from Optum, okay,
Yeah,
not from the health insurance company.
fair enough. Yeah.
They have Optum RX, they have Optum 360, they have all the practices they've purchased. I mean, this is where they're making the majority of their money. And if you look at a lot of the other health insurance companies, it's the same thing. And I think unfortunately, you talk about the healthcare, why it's so bad. We have all the technology in the world, but it's only a small sector of the population that takes advantage of that technology. There's a lot of people that do not. And just to kind of tie it together, what really this country needs is some type of a national health plan that people could buy into if they need to, and offer it as an option. And if anything, it'll keep the insurance companies honest as well.
I've always said that at least a two-tiered system would work very well here, I think.
Yeah, no, I completely agree, and it's
Yeah.
crazy that we don't have it, because almost every other nation in the world has some type of government health plan.
And I don't think we can go, like I was just teaching out in Germany. I don't think we can go fully to a government plan because
No,
that
not fully. An
that
option.
really hurt the doctors over there, and they're all looking to come here, right? Um, but I agree. You can't have physicians being upset and patients not getting good health care at the same time.
Right.
That
Yeah,
doesn't.
no, and
If
I don't know
physicians
how
were
much.
upset and we were getting great health care, okay, but we can't have both.
Yeah, because I don't know how much I like that idea. I'll give you two examples from from two different clients. One of them is U.S. born and is married to his wife is Russian. And when they met, she said, "I'm not sure. I'm not a gold digger by any means, but I'm not sure I want to be poor my whole life." In Russia, physicians don't make any money. Okay,
It's like a few $100s a month. That's
$300
it.
and something dollars a month, no joke.
It makes nothing.
Right? And so, fast forward to the conversation we had last night. If our client decides to go back home, to move back to, where's it, Argentina,
Yeah.
she will go from making 250 to, what was it, 35 grand. She won't be
we said 55, but she's like, yeah, but probably less than 55.
right, less than that. So I'm just giving a ballpark estimate, but this is what she said: it would be difficult for me to afford a place to live.
So here's another thing I'm going to throw out that hasn't been spoken yet, but I think it actually is an important issue. U.S. physicians do get paid more than physicians in other countries. However, U.S. physicians spend a fortune for their education. Most U.S. physicians are coming out close to $500,000 in debt.
That's insane.
And that's going to take years and years to pay off.
Mm-hmm.
So
we also come out older too. Our
come out older, yeah.
So that's 2 years of 2 to 4 years of earning power that's gone.
Right.
That's another, yeah.
Evan, is that the average? Is that a stat that we can lean on? 500K?
I mean,
I think the average is like 350,000, but to me that's a little bit low.
Well, you think about when we started our other team, Reed, back in the day, 15 plus years ago. I remember going and lecturing at universities, and I was talking about 170, 190, 15 years ago. And think about what's changed with inflation and everything else, and cost of education rising rapidly. 6% per year is kind of like the typical percentage.
Anthony, I'd like to end this podcast with final words from Evan. But before we do that, can you give me that one liner that you spat out about 15 minutes ago? What was that?
About
I've never worked so hard to get. I've never worked so hard to get into something.
I've never worked so hard as I did to get into medicine. and now I'm working just as hard to get out of medicine. And you know, the thing that we were talking about is side gigs, like what we're doing on the side, like trying to get patents, trying to kind of do other things. And you think about it, an NFL quarterback might have some advertising deals, but they're not trying to get out of football. They're trying to play as long as they
I
can.
was just getting ready to say, when was the last time you saw a professional athlete who was happy to retire? I mean, look at these guys. They're getting celebrated for an entire year. Look at Derek Jeter. His last year was literally a retirement at every stadium he played. Why do I bring up professional athletes? Because there's a reverence for them. There's a respect for them. But why are we respecting people who throw a ball so much more than people who save a life? I'm not expecting doctors to make $60 million a year. I wish they would, like a quarterback does, like a top tier quarterback, literally making $60 million a year. But they ought to be able to pay back their debt in a few years, not 12 years, not 10 years, which is what we're seeing with all of our clients. And we have quite a few clients. So I just wanted to nail that point home. Thank you, Anthony. And then Evan, what are your final words?
Well, I think that, you know, to go circling back, you know, I don't think that there should be only one option in this country, and that's a government health plan. But I think it should be there as an option for people who can afford private insurance. I still think that for people that can afford it, they would get some type of private insurance. I think there needs to be some type of a regulation on pricing, and there should be price transparency, and there should be oversight into private entity purchasing healthcare practices, whether or not they want to do it just for profit or whether or not they're really actually interested in maintaining good healthcare.
Evan, thanks so much for your time today. We appreciate you.
Thank you.
Thank you very much. This was great.
This has been the DocNation podcast. If you like what you heard, be sure to subscribe, rate, and leave us a review on Apple Podcasts, Spotify, or wherever you are listening to us. Your feedback really helps us reach more listeners like you. We'd also love to hear your thoughts and any topics you'd like us to cover in future episodes. Don't forget to follow us on Facebook, Instagram, and LinkedIn for updates, behind-the-scenes content, and to join the conversation. Thanks for listening.